I'm David Brindle. I'm the Public Services Editor at The Guardian, where we're delighted to have once again sponsored this award for AHPs working with people who live with mental health problems. This year's turn of events has surely underscored the importance of good mental health to all of us. Studies agree that the pandemic has damaged our well-being, and one calculation has suggested an average 8% worsening of mental health, with more than 2 in 3 of us admitting to being worried or very worried about the impact on our lives. AHPs, of course, play a vital but often overlooked role in supporting people who are struggling with their mental health, and our shortlist for this award showed the breadth and some of the different dimensions of that role. Nikki Thomas and Zena Bennett, occupational therapists at the Hywel Dda University Health Board, were instrumental in developing an IPS service, that's individual placement and support, to enable young people with experience of psychosis to access employment, education and training. Ali Coles, an art psychotherapist with Gloucestershire Health and Care NHS Foundation Trust, piloted and proved the value of basing psychotherapy groups for adults with complex mental health difficulties in a local museum, using museum objects to foster motivation and creativity. And Paul Scalan and Krishna Naidu of IPRS Health, a provider of corporate health and wellbeing services to employers, designed and developed a mental health self-referral portal that doubled numbers of people coming forward for help and cut waiting time for assessment from up to 10 days to the same day. So 3 contrasting but all hugely impressive projects.
I'm Zena Bennett, I'm an occupational therapist and I work in the Early Intervention Psychosis Employment Support Service. And over to you, Nikki.
Hi everyone, my name is Nikki Thomas and I'm Professional Lead Occupational Therapist for Mental Health within Hywel Dda University Health Board. Over to Angela.
And I'm Angela Lodwick. I'm Head of Specialist CAMS and Psychological Therapies, and this is Buddy, my dog.
The fascinating thing about our project is it's the first one in Wales to be working collaboratively with the third sector. We were lucky to secure funding from the Welsh Government, which Angela applied for. Our project works with young people from the age of 14 to 25 years, and they're either young people with an at-risk mental state, so we're trying to prevent them from developing psychosis, or they're having the first episode of psychosis. Using the individual placement support approach and working very closely with Mind, we are getting people from the Early Intervention Psychosis Service back to work, education and training.
We've got a vision that we'd like to expand this service across secondary mental health services so that we can actually support people with complex mental health needs. So why did we enter the Advancing Healthcare Awards? Well, I felt that this was a unique project and the successes of which I wanted to share on a national level, but also to recognise the hard work that the team have put in order to help people to reach their potential.
Hello, my name's Ali Coles and I'm an art psychotherapist with Gloucestershire Health and Care NHS Foundation Trust. So our project is using museums for art psychotherapy groups for adults with complex mental health difficulties. And this is one of the museums that we've been using. This is Stroud's Museum in the Park. Museum objects can evoke really powerful feelings and can help us to look at things in a different way. So what we've been doing is using museum exhibitions to help the group members to reflect, to explore themselves and also to inspire their art making. We've also found that using the natural environment of the museum has been really helpful, and we've got a really gorgeous park here that we can access. What we've found is that the group members really value this way of working, and they also value being in a setting that's rather different to the usual clinical setting and feeling a bit more connected to their local community. Museums have been closed because of the pandemic, but they are now reopening and we really hope to carry on working in this way. Of course, some museums have put their collections online, and there's the potential for using those online collections in online art psychotherapy groups, and that's something we're exploring. Being shortlisted for this award is a real tribute to the Trust, which has always been very forward-thinking and creative in the way that it responds to service user needs.
Hello, my name is Paul Scalan and I'm one of the clinical lead physiotherapists with IPRS Health.
Hi everyone, my name is Krishna Naidu. I'm Head of Client Relations at IPRS Health.
So the reason we chose to attend these awards and to submit for these awards was that we know the Advance in Healthcare Awards strives to look for innovation in healthcare. And at IPRS Health, our key focus is to try deliver innovation, quality of care, and certainly deliver an evidence-based practice to our patients and our clients.
I'm going to tell you a little bit about our project submission. So we've been delivering mental health services for sort of several years now. We have a large utilities client with a headcount of about 4,500 employees. We were delivering mental health services to our client for a number of years, and then the conversation came up with some user feedback and some feedback from occupational health, saying actually we wanted to improve the journey. We designed a safe and effective self-referral pathway, which is done online. Individuals would complete a self-referral form, and within a few days they would be speaking to a CBT practitioner. It's really sped up the journey, and it's been wonderful to see that the time and the effort we made to deliver on this project and streamline the service has really given back a lot to the users and the employees of our client. Such a simple thing has had such a massive impact in terms of user confidence. Referral numbers have doubled because I think people find it more accessible.
Weighing the relative merits of employment support, art therapy and occupational health was tricky, but in the end the judges were swayed by demonstrable outcomes and impact, and chose an initiative that made great use of technology to speed up access to a vital service while maintaining people's anonymity. So our winners are Paul Scalan and Krishna Naidu of IPRS Health. Congratulations.